Good day, my dear veterinary colleagues. My name is Dr. Erich Reinhart. I'm a veterinarian and I am working for HAIL in Baden-Baden, Germany, since in the veterinary department since some 20 years. I'm glad to have the opportunity today to present you some information concerning the HAIL company, the manufacturer of Tromil, the product which is in the focus of this presentation. Natural medicine is very much asked for by animal owners and by veterinarians because it's effective, it's well tolerated, and it can be used in a number of indications in veterinary medicine. The HAIL company has been founded in 1936 and it has become a pioneer since then in these more than 80 years in human medicine and has become a world market leader in ampules and other types of natural medicines for human use. But also HAIL is active since almost 40 years on the veterinary field. HAIL also produces quite a number of products for the veterinary use, and the company has grown meanwhile in this time, of course, and has now over 1,300 employees roundabout, and it makes 200 or 220 million euro of turnover in a year. The products are made in Germany. The manufacturing site is at Baden-Baden, Germany. So this is a very big fact for safeguarding and assuring the quality of the products at any time. From the very beginning on, HAIL had a scientific mission and they always wanted to research into their products, and they always wanted to go for the scientific proof of the HAIL medicine's efficacy and the safety. And all these scientific investigations have been made dedicated to the highest research standards. And there is an interdisciplinary global network from researchers all over the world, be it in commercial institutions, be it in academic institutions. And often that's a nice point, a nice fact that we hear again and again, that these research people are very amazed about the results that they get in their investigations. And afterwards, the results of the investigations are published in often very highly ranked international journals. And so again, are brought in contact with other researchers and with the medical community. HAIL has always had the strong will to have the highest quality possible in its products. One of the points that I mentioned already is that they are made in Germany, and all the production steps are done while adhering to highest international production standards like GMP, the International Good Manufacturing Practice, which is given by the WHO, the World Health Organization. And also with the HAIL products, this standard is a must. And thanks to the high quality levels that are kept throughout the time, HAIL has got the certification by the American authority, the FDA, the Food and Drug Administration, and also by other international authorities. All manufacturing steps are subject throughout all the time to certified testing and quality assurance. This means there are, if you would go into the production halls, you would always see like this lady, people that are controlling and reporting and documenting the whole process so that any step really can be traced for each single package. And that is what we think what a quality for a medicinal product, be it for human use or be it for veterinary use, should deliver, and HAIL products do deliver this quality guarantee. Our medicines for veterinary use, we do have quite a range. Meanwhile, in interesting products which can be used for the veterinary field, as I said already, we have almost 40 years of experience in manufacturing natural medicinal products for animals. And the ones on this slide are just examples for the well-known and very well accepted products, like the Solidago compositum for kidney problems, or the Zeal tablets in this case are used for osteoarthritis. The Engistol is a product for stabilizing the immune system, and the coenzyme compositum is used for the metabolism, also the metabolism within the cell, so that the cell can do its job, can fulfill its function, and be part of a healthy organ and a healthy organism. And now available for the Brazilian market, we are happy to announce that and to be able to deliver that to you, the Tromil ampules. Tromil is a very well-known and actually the probably most often used natural product in Germany in the vet practices as well. And you also will get the tablets, the Tromil tablets, in a short time, which makes that a very helpful tool in any veterinary practice. HALE has spread all over the world. Meanwhile, we do have a global presence, and HALE, the products are represented in many foreign markets, either by subsidiaries or by distribution partners, and it makes up at the moment for some 40 countries in the world where you can readily buy HALE products and use them in human or in the veterinary field. Our understanding of medicine is that naturopathy, and especially a substantiated naturopathy, which should be backed up by science and by sound evidence, and also by sound building of experience and practical observations, such a naturopathy should definitely be part of an integrative sort of medicine. We meanwhile know that these products, the natural products as they are often called, are acting via supporting the body's own self-regulating mechanisms. And in case of disease, of course, these self-regulating mechanisms obviously are not able anymore to keep the body and the organism and the organ functions within the natural and the physiological track. And so the mechanisms and the pathways need a certain impulse from outside, for instance, via a medicinal product. And HALE products do deliver these targeted and specific impulses for the specific disease. So because of these specific impulses, the products are effective on the one side, but also they are very well tolerated on the other side, which is a very good combination for the everyday practice for every veterinarian, actually. What does that mean, natural veterinary medicines from HALE Vet? As I said already, the HALE company was founded in 1936 by a human doctor with the name of Hans-Heinrich Reckeweg. And he was very active in creating products, but also he developed an overwhelming medical system, which then was called homotoxicology during the 1950s, and actually derived from this system of homotoxicology and fitting into this overwhelming building. He created combination preparations, which are combined of several active ingredients. That's why they are called multi-component. And on the other side, they act simultaneously on different pathways of the body, which means they act multi-target in order to resolve the causes of the disease. Because in disease, usually it's not just one pathway that is running wrong, but it's a number of pathways which all are interconnected to each other and to further systems again. And for this reason, you best try to heal and to cure a patient with multi-target product, which addresses a lot of these disturbed pathways and interconnections to heal the patient from the ground. I got a nice video that I wanted to show you, and we want to make sure that you as veterinarians do have this information on multi-component and multi-target products, and so that you can pass on these informations to your animal owners and to your clients to make them clear why this type of natural medicine is the best in almost any, or at least in a lot of patients, not in every patient, but in a lot of patients where natural help can deliver relevant support for the patient.
Natural veterinary medicine. The body is a complex biological network. It is composed of organs, cells, and molecules. Permanent self-regulation ensures that functional disruptions do not immediately cause an illness. Diseases are caused by disruptions of regulatory mechanisms, for instance, due to injuries. In these cases, it is important to modulate the affected networks, to strengthen the involved organs and tissues, and eliminate the disruptions. Mode of action of natural veterinary pharmaceuticals. Treatment with natural pharmaceuticals such as Traumale or Sale for animals strengthens the self-regulatory mechanisms. By this, they support the body to help itself. The combination of several active ingredients, multi-component approach, acts simultaneously in different parts of the body, multi-target action, in order to tackle the causes of the illness. Natural veterinary pharmaceuticals have a high tolerability and can be safely combined with other drugs, including conventional medications. Contact your veterinarian for details on natural veterinary medications by Hale Vet.
So I think this was a short overview of the whole system, the whole model. And if we want to summarize again this multi-component, multi-target principle, the diseases are complex processes and multiple pathways usually are affected in the organism. It's not just one pathway which can be blocked or which should be suppressed, and that's it. That's conventional medicine. And we do, of course, not want to block just one pathway if a number, tens or hundreds of pathways are disturbed. So the Hale products, which are composed of multiple active ingredients, do address this multitude of disturbed pathways and do address them simultaneously to heal the patient from the ground, and so to resolve the causes of the disease in a sustainable way, which really means a healing from the ground on and resolves all problems and all disturbed functions in the organism. That's an important part of the whole system, which is used by the natural products. Hale products are able to treat diseases with low side effects because they do actually speak and use the body's own language. They do address only the pathways that are disturbed with their weak impulses that are sufficient to get the autoregulation of the body back onto track again. And that means health is back again in the patient. I want to show you some examples how Traumel acts on different levels. Examples for how Traumel acts in a multi-target way. Number one, scientific study number one is directed on or based on the helena-line. Helena-line is a compound in the ingredient arnica, the plant Arnica montana, which is one ingredient of Traumel. And helena-line within this plant arnica acts in an anti-inflammatory way on the so-called transcription factor NF-kappa B. And NF-kappa B is sort of a main switch, which is very relevant. Actually, it's a crucial element in upregulating an inflammation or downregulating an inflammation. And if helena-line acts directly on this main switch towards a downregulation of any inflammation or any inflammatory processes, then the tendency in the body is to reduce an inflammation. So in the end, in the clinical sum up, it's an anti-inflammatory effect, but it's rather an inflammation modulating effect rather than suppressing or blocking any specific pathways, as you might know it from conventional medicine. A second example for a scientific study dealing with Traumel is that one has investigated if there is any effect of Traumel on cytokines, on pro-inflammatory cytokines like the IL-1 beta and the TNF-alpha. And indeed, this has been confirmed that Traumel downregulates these two very important and very well-known cytokines that usually do upregulate the inflammation. And again, Traumel makes a downregulation of this two further elements of the inflammatory process. Now, two more examples for additional targets that are addressed or additional levels where Traumel is working, how Traumel is working. Number three, Traumel acts in vivo in laboratory animals via regulation of genes involved in interleukin pathways, like for interleukin-1 beta, we saw that already, IL-18, IL-36, which all are pro-inflammatory. And Traumel acts on the gene level so that these genes are not so much expressed for these pro-inflammatory interleukins, and thus again tends to and helps to downregulate the inflammation. Again, important in the body's own language. Also, they investigated in this study if the genes for fast wound healing are affected. And again, these genes were more expressed. So in the result, this confirms what one often observes in the clinical reality, that in this scientific study, the genes work towards this clinical result, namely fast and uncomplicated wound healing that you often can observe after use of Traumel, even in tricky situations that often enough, of course, can be the reality in clinical practice. And the last study, which was published only last year, deals with a new level of things that maybe in the veterinarian community is not yet totally known. The state of knowledge, how an inflammation is ended by the body's own mechanisms, is that there are specific mediators needed that produce by their action, that produce an inflammation resolution. And the people in this study really examined how or if Tromil supports the synthesis of such specific mediators for inflammation resolution. And again, this was the case. So one more mechanism how Tromil helps to softly downregulate and to softly end an inflammation in the body. This study, the last one, this number 4, was published in a very high-ranked international journal again. So this confirms the quality of the study and confirms the quality of the findings and the relevance of the findings as well. The forefront of the inflammation researchers are right now and since a number of years dealing with this process of inflammation resolution. And again, Tromil has found its very prominent place in this mechanism, which is a new site on the inflammation and on ending an inflammation in the organism. And Tromil again is active in that role, supporting inflammation resolution and thus down-regulating with physiological means, the means of the body itself, inflammation. So I have showed you some examples from the scientific side. I think you'll hear a number of more of them, and maybe I could make you curious. I only can encourage you to start working with Tromil, and I'm pretty sure if you have used it for a couple of times, you won't want to miss it anymore in your practice. Thank you, and with this, I hand over.
So hello, thanks Erich for your introduction. I'm Tina Wassing, I'm a veterinarian also from Germany, and I have an own practice for small animals and horses. And I'm going to talk to you about the use of Tromil at Usvet, so that you get more information how to use it in your own practice, that you can use it also in combination with normal medication, for example, with NSAIDs and antibiotics. So first of all, I think not really many of you will know the Tromil injection solution. So we just talk a little bit about for which indications we will use it. So as we already told, Tromil is a multi-component, multi-target veterinary medicine made of natural ingredients, and it's indicated for cattle, horses, donkeys, goats, sheep and pigs, and of course also for canines, felines, rabbits and birds. And we will use a Tromil for the treatment of injuries, wounds, claudication, distensions, contusions, hematomas, pain reduction, postoperative and inflammatory processes of the musculoskeletal system, and such as arthritis, tendovaginitis, and bursitis. And we also will use the Tromil as a supportive treatment in inflammatory conditions of various sites, such as phlegmone, abscesses, dermatitis, and mastitis. So, as you can see, all where we see inflammation in our daily routine, we can use the Tromil for modulation of inflammation. So let's talk a little bit about inflammation. And I think all these pictures you know from your daily routine. And normally we will start with, in these cases, with a treatment with an NSAID. And so what is the idea of the treatment with an NSAID? So normally we will use the NSAID as a single target medication to block pathogenetic pathways and to get rid of the inflammation and the pain. And of course, in many cases we will see in our daily routine, we also have to talk to the owner about the removement and the avoid triggers. And for example, when we have a hard overweight dog which is limping, we also have to talk to the owner about the influence of the lifestyle changes and to get rid of the weight. But normally when the owner comes with his animal to the vet, he wants a medication. When we are more talking about the idea of multi-component and multi-target medicine, and we already heard something about this from Erich, we are talking about the enhancement of autoregulation. So we all know when we have a disease, we see in the pathogenesis an insufficient autoregulation capacity, and that's why we use a multi-component, multi-target medicine in these cases. So why we do not only want to use the NSAIDs to get rid of the pain and the inflammation, as we were told by Dr. Peretti on the 10th World Congress on Inflammation in Paris in 2011, he told us inflammation is good for you, or not only good for us, also good for our animals. Because the cardinal signs of the inflammations shown as pain caused by the mediators increase the sensitivity to pain, then we see the redness and the heat caused by the vasodilatation and the increased blood flow. We will see the swelling by exudation of plasma proteins and the fluid into the tissue. And of course, we will see the loss of function as a response to pain. And this makes sure that the dog or the cat or the horse tries to reduce the load on the inflamed leg, for example. So when we are talking about additional treatment with Traumeel at Osvet, I just got a case report. This is a dog which had a bite injury. The dog has a weight of 26 kilos. And we first started with additional treatment with the wound cleaning before we closed the wound with 20 milliliters Traumeel at Osvet. And then we continued the treatment. Of course, we made an injection with antibiotics, and the dog got the day of the surgery also an NSAID. And then we continued the treatment on day 1, 2, and 4 with an injection, subcutaneous injection of Traumeel, 3 milliliters in this case. And we also continued the treatment with an oral dose for the next 14 days of 3 milliliters Traumeel at Osvet as an oral dose once a day, or until the time you can buy also or you can order also the tablets. You can also give the tablets to the owner, and they will use the tablets 2 to 3 times daily and 3 tablets per dose. And in this case, the dog got the antibiotics over 5 days and only got 1 injection of NSAIDs. And because the dog showed no hard signs of pain and no hard signs of inflammation, we decided that we will not continue with the dose of the NSAIDs. So the dog only got, after the surgery, a daily dose of Traumeel. As you can see, the healing process was very well, and the owner was very excited and the dog also very happy. Just to talk a little bit about the dosage table we have. Now at the moment you only can buy the Traumeel ampoules, but I think that will not be only Traumeel, you can buy the next time. So the dosage table, it's very easy to use the heal medication because we have the same dosage for all ampoules and all tablets we have. So you only have to know it for once. When we are talking about horses up to 500 kilo, we will use 5 milliliters daily of the injection solution and 6 to 8 tablets, 2 to 3 times a day. When the horse is over 500 kilo, we will use 10 milliliter daily of the injection solution and 10 tablets 2 to 3 times a day. And in cases of small animals, so we will get to dogs and cats under 15 kilos, 1 to 2 milliliters daily and 1 tablet 2 to 3 times a day. Medium-sized dogs, around about 15 to 25 kilo, will get 2 milliliter injection solution daily and 2 tablets 2 to 3 times a day. And large dogs over 25 kilo will get 3 to 4 milliliters of the injection solution daily and 3 tablets 2 to 3 times a day. So as you can see, it's very easy to make the treatment with the HEAL products and of course also with the Traumeel. When we are talking to mild to moderate lameness, and I think it's the same in Brazil, that many of our clients don't want directly the NSAID for their dogs. So they are asking us if there is any kind of other possibility to get rid of the NSAIDs. And I think we all know the dogs with a contraindication, and of course also the cats with the contraindications. The really young ones or the older ones with chronic kidney disease, for example, where we try to get rid of the use of the NSAID, and there's a good opinion to use the Traumeel in these cases of mild to moderate lameness. Because we all know injuries can happen everywhere, anytime, and as you can see in the picture, there are two examples for acute injured tooth, and of course we will make a good diagnosis to be sure that there's no fracture, and we don't have to take surgical care for these dogs. But when we're only talking about inflammation, hematoma, for example, then it's very useful to use the Traumeel also as a monotherapy. So what we're going to do, we make injections on day 1, 2, and 4 and continue if necessary up to the weight. We will use 1 to 3 milliliter as a subcutaneous injection of Traumeel Atosvet, and the owner will give the oral dose once a day of 1 or 3 milliliters Traumeel from the injection solution, or from the tablets 2 to 3 times a day, 1 to 3 tablets. There are added some more therapy themes. One is, I think, more the same we already had about this, mild to moderate lameness in the front leg. And as you can see, it's always the same therapy plan, so it's very easy to remember and very easy to use. We start with the injection on day 1 and day 2, and continue with 1 on day 4, and if necessary, repeat the injection scheme. And the oral therapy will be started by the pet owner at home with the injection solution or with the tablets. Another therapy example, distortion of left forelimb following agility training. The same again, injection therapy if needed by the vet on day 1, day 2, and day 4 if it's necessary, and start immediately with a oral therapy by the pet owner with the injection solution as an oral dose or the tablets. And many of our clients already have the Traumeel at home. So with only mild to moderate lameness, for example, at the weekend, they will start with a treatment at home with a Traumeel, and then come to the practice on Monday if the dog is still limping. And many of them do not really need to do more than to give the Traumeel. Another example for a hematoma, in this case, a chest wall injury during a play. And same procedure as every day. We make the injection day 1, day 2, and day 4. And if necessary, repeat the injection. And the owner starts with oral therapy with the injection solution or the tablets at home. So let's get more inside the detail of Traumeel Atosvet. You already heard something about the multi-component, multi-target system. And just to let you know, there are 14 ingredients, natural ingredients in the Traumeel. This is a combination of the individual agents, and the combination has synergistic and potentiating effects, and the synergistic cooperation has an effect of the combination exceed the sum of the active and components. And that's why it's working so really great and fine. So the multi-target ingredients address the different aspects of inflammatory response. In our case of Traumeel, we are talking about inflammation. And when we are talking about inflammation, we want to do something against the analgesic, the antiphlogistic, and the detumescent. And that's how Traumeel works. So Traumeel inhibits, stimulates, and modulates the various parts of the inflammatory process. Once again, a little bit more to the mode of action and the modulation of the inflammatory activities. We know from the research results that when we use the traumeel, we have an inhibition of pro-inflammatory cytokines as IL-1 beta, IL-8, TNF-alpha, and the inhibition of pro-inflammatory enzymes such as COX-1 and COX-2. We also see a stimulation of anti-inflammatory cytokines, the TGF-beta, and we also see an increase of the defense function of granulocytes and lymphocytes. And all these effects make the modulation of the inflammatory activities when we use the traumeel. Every time we see a case of inflammation and trauma, we can use the traumeel as a therapeutical option. As, of course, in not severe cases as a monotherapy, or always also in combinations with NSAIDs and antibiotics, and of course also in cases where we have to use corticosteroids. And when you're asked by the owner, no other medication has a problem with the use of traumeel, so they can use as normal, for example, heart medication or medication against proteinuria, for example. So when we see cases of trauma and inflammation, we use the traumeel as injection on day 1, 2, and 4 and continue if necessary, 1 to 3 milliliter, as we already heard several times as a subcutaneous injection. And the owner will do the oral dose as home with the injection solution or with the tablets. One more case report of an inflamed injury. It was a 12-year-old cat which lived or still lives in a stable. And the suspected diagnosis was a chronic kidney disease. And the biggest problem of this cat, or for us and for us as a veterinarian, and of course also for the owner, that the cat is really wild and free roaming and really very unfriendly. So they catched her in a case, and because they saw she had, or it had, an inflamed injury near the ear, and we had to sedate her to make the treatment. And we decided after a wound cleaning that we will use a monotherapy of the traumeel, because the owner told us that he will not ever be able to get any kind of antibiotics every day or 2 times a day inside the cat. So that's why we only use the traumeel. So we started with the wound cleaning with the traumeel. And after the wound cleaning and 1 injection with the traumeel, 1 milliliter, while she was sleeping, the owner continued with the oral administration of 1 milliliter traumeel with the food for 4 days. And as you see, as a fine result, 4 days later, there's the heart inflamed injury starts to heal. So why so many cat owners really love the use of traumeel and also of other heel medications? It's so easy to give and easy to dose. So when we're talking about cats and dogs, of course, it's the same. So it's very easy to get the medication inside the cat. We can make the medication via injection. We also can make the medication direct orally by the owner, and also the owner can give the medication via food. So it's we all otherwise to say we will find a way to get the medication inside the cat. And normally, no cat and no dog will recognize the medication inside the food, because the injection solution only tastes a little bit salty. So it's normally no problem, and they will eat it with the food. When you make surgery in your practice, and I think everybody of you will make surgery in the daily routine, we know that every surgery causes a certain degree of inflammation. So we also have a good tracheal application opinion in these surgery cases. So we can use it as a local application intraoperationem. In Germany, it's in off-label use because it's only allowed to use it as a subcutaneous injection, but we all use it in Germany as an off-label use and a local application in intraoperationem cases. We also can use the tracheal atosvet postoperationem as a subcutaneous injection, and the owner continues with an oral dose at home for 10 days. And normally in these cases of castration or planned surgery, we do not need to make the injections on day 2 and day 4. So normally the owner continues with an oral dose at home. What about surgical intervention? Another case report, a lacerated wound. We will start with a wound cleaning before closure with a tracheal atosvet, and then continue with an injection, subcutaneous injection on day 1 and 2. And repeat, of course, if it's necessary. When it's a bigger wound or it's an infected wound, then we will continue with the injection every 2 to 3 days. And the owner continues with an oral dose tracheal atosvet 3 milliliter daily orally, or 3 tablets 3 times for 14 days. Normally for 14 days or for 10 days until we will remove the staples, for example. Another case report is another bite injury, and a little bit harder than the first pictures you saw. And there we use the tracheal as an add-on with conventional therapy. So of course this dog got antibiotics and NSAID, and we use the tracheal again for the wound cleaning, the injection and the oral dose, as we already talked about this. And as you see, also a fine outcome for this dog. There are not only cases of acute inflammation in our daily routine. So we see many, for example, old dog or hardly injured dogs with recurrent inflammation and recovery. And we also have a great therapeutical option in the use of tracheal. So then we will use the injections twice a week over around about 4 weeks. And also as a subcutaneous injection in cases, for example, with back pain, we also can make paravertebral injections once a week, or also in cases of acute or recurrent arthritis, we will use the tracheal for periarticular injection, and it really works very fine. Also once a week, and we will make the injection with 1 to 2 milliliter tracheal for every point we make the injection. Normally, when I make paravertebral injection on the back or against back pain, then I will make injections over 5 to 6 points of the back on both sides, and make injections with 1 milliliter to 2 milliliter tracheal atosvet. And once again, the owner gives an oral dose at home with tracheal injection solution or with the tablets. We do not only have human studies, we also have a small kind of veterinary studies. This is one published in 2015. It was an observational study, and which investigates the efficacy and tolerability of tracheal in dogs with acute uncomplicated lameness. And the study design, it was a multicentric retrospective observational study based on the data of 325 dogs. The average age of the dogs was 5.5 years, and the average weight was 22 kilos. And the tentative diagnoses were contusions, strange, hematomas, and combinations thereof. And the study medication was initially and exclusively with tracheal atosvet. And they used the tablets and or the injection solution. And they also used in some cases the gel. So I think you will get the gel also in Brazil in some time. We also have a tracheal gel for the local application. And the overall treatment was 7 to 28 days. The average was 10.7 days, and the treatment over 7 days were made in 32%, 8 to 10 days were 32%, and 11 to 14 days, 23.7%, and 15 to 18 days of overall treatment were only 20.3% of the dogs. So these were the study parameters. So they looked for the extent of symptom improvement, the time until the symptom improvement, the time until the symptom-free, and the global assessment of efficacy and tolerability. And the efficacy was related to the symptoms of lameness, swelling, pain on palpation, and limitation of passive movement. So as you can see in the diagrams, and it's not very difficult to see the change in the symptom score. So the time of the first presentation is the light red one, and the red one is the end control. And as we can see in every cases of lameness, contusion, pain on palpation, and movement restriction, we saw a reduction of the symptoms. And the same when we look to the grade of the lameness, we all see from the time of the first presentation to the end of control, the grade of lameness was reduced, or we will see no symptoms anymore in the best case. And when we take a closer look to the global assessment of efficacy and tolerability, as you can see, the German vets really love the Traumeel. So 76.9% of them said Traumeel works excellent, and 17.7% said it worked good. And of course, you will only have the few ones which are only satisfied or unsatisfied with the use of Traumeel. But I think, as you can see, the most of them really loved the use of the Traumeel. Just a little or small words for the Traumeel in combination with NSAIDs. We often have cases of heart-injured dogs or big surgery where we cannot live, or the dog cannot live without a dose of NSAID over a few days. But we all know that we see several side effects when we use the NSAID, and the older the dog gets and the older the cat gets, the more side effects we will see. And as we know, when we use NSAIDs, we see an inhibition of COX-2. That's what we wanted to see, and that's what we suggest how it works. And when we look to the study results of the Traumeel, we all know that when we reduce the COX-2, we will see higher levels of COX-1. And that's why we also see a benefit when we use the Traumeel in combination with the NSAID. So we will see only, we will also see inhibition of the pro-inflammatory enzyme COX-1. And of course, we also see a reduction of the pro-inflammatory cytokines. So the good and the evil and the NSAID side effects. Every NSAID has systemic effects. That's what we wanted to see when we use the NSAID. So we will see the pain relief, we will see the work anti-inflammatory, and we will want to see the effect of the antipyretic of the NSAIDs. And what we don't want to see, but we all know these cases, is the damage of the microcirculation and causing ischemia. And in the second case, we see the inhibition of the protective prostaglandins with a decreased blood flow in the organs. And this causes the side effects we all know on the gastrointestinal tract, on the kidneys, on the liver, on the cardiovascular system. And we also see when we use the NSAID, or when we have to use the NSAID over a long term, then we also see an inhibition of wound healing and bone remodeling. And that's why I just want to let you know how important it is to combine the Traumeel with the NSAID in every case. So when you're not sure, when you start with a medication or with the use of Traumeel, and when you are not really sure if it's enough to use the Traumeel, then don't be shy and also use the Traumeel together with the NSAID. So normally we will suggest, and that's what I see in my daily routine, that I can get rid of the NSAID after a few days. So in many cases where we normally use the NSAID after surgery over 10 days, we normally only will use the NSAID over 3 to 5 days, and then we will get rid of the NSAID and continue the treatment as a monotherapy with the Traumeel. And let's talk a little bit about horses. And we see the same inflammation and the same injuries, or nearly the same injuries in horses than in dogs or cats. And we have the same therapeutical options, and we will use the injection and the oral dose the same as we already talked about the small animals, but we will give more of the ampoule solution. So we will make injections in cases of trauma and inflammation on day 1, 2, and 4, and continue if necessary of 5 to 10 milliliters. When the horse is under 500 kilos, we will use 5 milliliters. When the horse is over 500 kilos, we will use 10 milliliters. The oral dose, we will give 5 to 10 milliliters Traumeel injection solution once a day, or the most horse owners really love the tablets because it's much more cheaper than the injection solution. When you have to give 10 milliliters a day, they decide to use the tablets, and they will give 2 to 3 times a day, 6 to 7 tablets Traumeel, most time with a food. A small case report. This was a bruise after a trailer accident. Unfortunately, this horse was on his way to a competition, so the owner made a call what he can do without getting any kind of problem with detection time. And so we talked to him, okay, talk to the vet that he can make an injection of 10 milliliters Traumeel at his vet. And as you can see, 8 hours later, there's no more swelling, no signs of inflammation. So it was no problem to continue with the horse, the competition. And what about acute injuries? And we have the same therapy schemes for horses. In this case, contusion of the fetlock. And as you see, the same as we talked about the small animals, we make the injection on day 1, day 2, and day 4, and continue if necessary. And the oral therapy starts on day 1, given by the animal owner, and they will give the tablets or the injection solution orally. The second therapy example is a kick injury on the meadow. And we first will clean the superficial wound with a sterile solution, in this case with a Traumeel atosvet ampoules, and continue with an Traumeel subcutaneous injection. And if it's applicable, then we will follow with an injection on day 5. And the owner starts with an oral dose of the Traumeel ampoule solution or with the tablets on day 1 and continue for 14 days, and if it's necessary, until the symptoms resolve. One more therapeutical options. We already talked about this in the cases for the small animals. We see many horses having back pain caused by the saddle or caused by the rider or caused by the rider and the saddle. So we also can make paravertebral injections once a week with 1 to 2 milliliters per injection site with a Traumeel inside the muscle. And we also can make injections on day 1, 2, and 4 and continue if necessary in cases of recurrent inflammation or acute inflammation of 5 to 10 milliliters Traumeel. And the owner also will give an oral dose of the Traumeel and 5 to 10 milliliters, or he can use the tablets 2 or 3 times a day. And in cases with recurrent inflammation or recovery, we make injections twice a week over 4 weeks with 5 to 10 milliliters subcutaneous injection with Traumeel atosvet, and the owner will also give an oral dose of 5 to 10 milliliters, or can use the tablets 2 to 3 times a day. I hope you enjoyed my speak, and I really hope that I can get you an idea how to use the Traumeel and how to combine it with your normal medication inside your work. And as Erich always also told us, that it's really amazing to use the Traumeel in our daily routine. And you will really be happy to see how good the inflammation modulation will work with the Traumeel at Usvet.